What advice would you both give to the audience here today concerning Parkinson's disease before they leave? Start with you, Dr. Sriram.
My advice is, if you do have Parkinson's, I would advise to stay active, stay motivated. Take your pills. My rule is every time, on time. And just make sure that there is a movement neurologist or a Parkinson's specialist part of your care plan. And the last but not the least is that there is no cure for Parkinson's at current time, but certainly there is hope.
Well, in addition to what Dr. Sriram just said, I would encourage you to focus on the things that you can control, and that would be exercise and therapies. Exercise is really important for a lot of different reasons, but let me give you just 3. So one is that we know that patients who exercise when they come in the clinic to see Dr. Sriram or myself, they're moving better. The second is that with regular exercise, we can actually reduce the risk of falling. There's a study that looks at patients with Parkinson's, and they take half, and half of them do Tai Chi. Tai Chi is a form of Eastern exercise. And the other half only stretch. Well, the half that did Tai Chi had a 60% reduction in fall risk. And the third, and maybe the most important, is that we have some research models that suggest that regular aerobic exercise may actually slow down the progression of Parkinson's. There are a lot of ways to get involved in the exercise community in Parkinson's right here in West Michigan. There's Tai Chi, there's yoga, the Grand Rapids Ballet does dancing for Parkinson's, there's non-contact boxing called Rocksteady, and there's pedaling for Parkinson's, which is bicycling. I'm sure I'm missing others. But I think that the most important thing about exercise is to find something that you enjoy doing. Because if you don't enjoy it, there's no way you're going to stick with it.
Absolutely.
And the second most important thing is that it's safe. So make sure you talk with your doctor, with your therapist, about developing an exercise program that would be right for you. So exercise, 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 as well as therapies. And we've talked about physical therapy, occupational therapy, and speech therapy. But there are types of those therapies that have been specifically designed for patients with Parkinson's. This is called LSVT big for the physical and occupational therapy portion, and LSVT loud for the speech therapy portion. And what the big therapy does is it focuses on big, large amplitude movements. Because when we develop Parkinson's, we tend to scale our movements down. This also reduces our fall risk, and we move better after we've completed therapies. The loud portion focuses on our projection of the voice. Well, that's not the only thing it does. It also improves our facial expression. It also reduces the risk of us swallowing down the wrong tube and getting a pneumonia. But you can go through and you can do those big and loud therapies, but the most important thing about doing it is that you then go home and you do the therapies at home as well. Because if you don't use it, you'll lose it.
Thank you. So the takeaway for the audience is that understanding of how important it is in teaming up. Teaming up with a Parkinson's specialist who engages both with the patient's family, and the team members to develop an individualized plan.